Why did you use the Nova BioCare implants as opposed to the ITI implants?
When you spend $21,000 for a certain system, that tends to be the one you use.
How do you mean $21,000?
Well, when I originally started placing implants, that was the cost of that system. I became familiar with the use of the system, and I had what I thought was reasonably good success with it, so I've continued to use it.
Okay. Have you ever been involved with clinical studies which were sponsored by private companies?
Well, it's asked and answered.
I don't think so.
It's vague and ambiguous also. I think if he knows what you mean by clinical studies.
If he'll drop sponsored, the answer is yes. If he keeps sponsored, the answer is no.
Why does sponsored make a difference?
Sponsored connotes getting paid.
What do you mean getting paid?
Sponsored means that somebody paid me to do a study. That's what it means to me.
Right.
And if that's what you mean, the answer is no.
Okay.
Wrong. I got $1,100 from something not related to any of this, but I was paid $1,100 for something.
So then you've never been involved with any kind of a clinical trial which was funded by a private company, and either it was done at your office or you were involved with some kind of a university that did such a report or such a study. Is that accurate?
Well, can I just ask you, what do you mean that I was paid to do the study? That's what I have to have clear.
When you say paid, I mean
did somebody give me any money to do the study? That's what I want to know.
To compensate you for your time and your efforts, etc.
Other than the one I mentioned, no.
Okay. All right. And so then you are personally involved in the study of 8 implants of the Mark III, correct?
That was how many I was allotted to for the study, correct.
Okay. And then other dentists are also doing their own implants?
In the study?
Yes, in the study.
Correct.
Okay. And you are allotted 8 implants by whom?
Nova BioCare.
Okay, so at some point in time there were discussions between you and Nova BioCare about this research study of the Mark III?
Yes.
Okay. And was there some agreement that you would receive some compensation for the performance of this study?
Yes.
And what was the compensation you were to receive?
The compensation was as follows. The usual and customary fee was presented to the patient, and the patient was then informed about the study and told that the surgeon and the restorative dentist would receive $500 towards their fee if they participated in the study. And all the parts, meaning the implants, and all the parts, meaning the implants and the things necessary to place the implants and restore them, but not the final bridge work.
All right, so the summary, again, not really the exact numbers, maybe somewhere 8 to 10.
Yeah, closer to 8 maybe.
Okay, 8 to 10 professional meetings of some sort at which you have spoke on behalf of Nova BioCare or BraneBill. Is that a correct statement?
On behalf of or about? What are you talking about on behalf of here?
What do we, in other words, can
you clarify what you mean?
Fine. You receive compensation to speak at these meetings about Nova BioCare products. Is that true?
That's less than 8 then. I go from 3 to 5 on that, if that's what you mean.
Okay. What would the others be, the ones you're excluding?
Well, in the course of giving a lecture, I may mention that I'm using a BraneBill implant. I try not to use the word Nova BioCare.
Okay, but again, focusing now on lectures where you receive some kind of compensation.
Well, very few. That's
the 3 to 5?
I'd say maybe 3.
Okay.
Is that an estimate?
Yeah, that's an estimate, but it's no more than 5.
Okay. So just to summarize, you would estimate that best estimate 3, no more than 5, professional meetings or symposiums that you have got up and spoke about Branimark or Noble Biocare products and received compensation from that company?
Exactly.
All right. Then there's other professional meetings, I assume, in your career that you have mentioned in some way Noble Biocare or Branimark products, but not received compensation from that company for doing so. Is that correct also?
Exactly.
Right. And would you be able to say how many professional meetings fall, or symposiums, fall in that category?
Many.
Has Branimark or Noble Biocare ever paid for your travel or lodging in connection with any professional meeting or seminar or symposium?
Yes, they have.
How many times has that happened?
Three.
What were those events?
You mean want me to name where I went?
I assume it was some kind of a professional meeting or something.
Yeah. You want me to
right. Yes.
Tell you where I was? Okay.
Yes.
I'll go from the most recent backwards. The most recent one is I gave a lecture in Thailand. What the hell's the name of that? It'll come back to me. Thailand. And from there I went to Bombay, India. From Bombay, India I went to Seoul, Korea. And then on home. So that's the most recent one.
So is that the three? That's just
No, that's one.
Okay.
That was one tour.
When was that?
2 months ago. 2.5 months.
Okay. And where did you go in Thailand, India, and Korea? Or some kind of, what was the event that you were actually involved with?
Each one was an implant meeting of some sort. The one in Thailand was specifically on Noble Biocare, a Noble Biocare program. The one in Bombay was a generic prosthetic dental implant program, and the one in Seoul, Korea was a Branimark Stereos program. Stereos, Steri, and it's OSS.
Do you recall if the Sargon implant was mentioned at all at the Bombay? No, you don't recall it? No, it was not.
It was not.
And in regard to that particular trip, which you went to 3 different places, your travel and lodgings were paid for by Noble Biocare. Is that accurate?
Correct.
Okay. Did you also receive any honorariums?
Yes, I did.
Okay. For all 3 lectures? I
was paid $3,000 for each lecture, plus 1 business class ticket.
Okay, and there were 3 lectures altogether,
That's
one in
correct.
each place. Okay. And then you were that was the most recent.
Yes.
There were 2 others.
Now we're going backwards. Last December, I was at the NYU Implant Conference.
Okay, and Noble Biocare paid your travel and lodging to that event?
Travel. I'm not sure about the lodging.
Did you also receive an honorarium?
Yeah.
Okay. How many speeches?
How many speeches or how many dollars?
First I'm going to ask speeches, then I'm going to ask dollars.
Only 1 speech.
How much?
$1,000.
Okay. All right. And then I think there's 1 remaining.
Yes.
And what was that?
Where was it?
Where or what was
that?
The
Was the Noble Biocare Team Days, and that was in London. I have to guess on the years, 4 or 5 years ago.
That's your best estimate?
Yeah.
Perfect. Okay. And they paid your lodging and travel for that event?
Yes.
And you also received an honorarium?
Correct.
Okay. By the way, what's the derivation of BraneBill? How was that arrived at as your email?
I use Branimark implants. It's the beginning of the...
Did you ever ask Branimark or Noble Biocare or Noble Pharma for their permission to call yourself
No.
BraneBill?